welcome everyone. Thank you for attending this session. Children with problematic sexual behavior, who are they, and how can we help them? Now you are in the hands of Dr. Shields.
Hello, everyone. Welcome to our virtual conference today. It is so good to be with you all, even if we can't be together in person. And I will share, I can see that we've got many of you participating in our platform here, but I cannot see any of your wonderful faces. So I do feel a little bit like I'm speaking into a black hole, but you can go ahead and engage with us in the chat box. And Krista has been so gracious to volunteer to share questions as they come up. Krista, just as a reminder, I'm not able to see any of the chat on the virtual platform, so just share them with me. Feel free to interrupt me as we go through. My name is Dr. Jennifer Shields. I am a licensed clinical psychologist by training, and I am actually based out of beautiful Oklahoma City, Oklahoma, here at the Center on Child Abuse and Neglect. We are very fortunate here in Oklahoma City to actually house the National Center on the Sexual Behavior of Youth. And so I hold faculty positions both with OU and with our National Center here. And today's presentation is really intended to be an overview for you all about children with problematic sexual behavior. You may feel a little bit like, gosh, this is a Prevent Child Abuse America conference. What is this topic and how does this fit into everything? But I hope today by the end of our presentation that becomes a little bit more clear. Go ahead and get started. I always like to share that I'm part of a huge, amazing team here at the National Center. Mark Chaffin, who has sadly passed away, but Jane Selevsky, Barbara Bonner, Lucy Berliner, Elizabeth Bard, a lot of great people have walked this road before me, and I'm very thankful to be able to share a lot of what they've learned today. So before we get started, it's always helpful for me to know when I'm presenting to multidisciplinary audiences a little bit about who I have in the room, or the virtual room, I suppose. There was a poll question on our platform. If you could go ahead and respond to that poll, it'll just ask you a little bit about what discipline or background and perspective you're joining us from today. And Krista, maybe if you could share as those are responded to. Krista, does it look like people are responding to the poll? It looks like people are having a little bit of trouble finding it. I'm not hearing from Krista directly, so I'll go ahead and see maybe if I stop sharing this, if I'm able to.
Okay, can you hear me?
I can hear you now.
All right. So we have 2 from Juvenile Justice, 23 from Child Advocacy Center, 10 from Mental Health, 6 from schools.
Okay, excellent.
Mm-hmm.
So yes, Michelle, it does look like if you're on Zoom, you can't see it from this platform, but it is in our platform on Prevent Child Abuse America. Thank you so much. Okay.
Okay.
And the other thing I want to touch base on, you able to see that okay, Krista?
Yes, I can see that perfectly,
okay.
Yes.
How much do you all know about children that have problematic sexual behavior? What would you say kind of the knowledge you're coming in with today? Do you feel like you're a pro, you know, quite a bit, but you'd still love to learn more, maybe not so much about this topic, or maybe this is your first time even hearing about these youth? Excellent. So it looks like maybe nobody's claiming pro status, and I don't even know if I'd claim that for myself we can always learn more about this topic, but this is going to be a good introduction then for many of you who are being acquainted with this topic and would love to learn some more. All right. So I'd love to hear just a little bit from you all what thoughts you have about kids that have problematic sexual behavior. Why do you think they develop it? And is it even safe for these kids when they have a problematic sexual behavior to be around other children? What kinds of treatments are going to be needed? And we're going to talk through all of these topics today. So childhood sexual development, for those of you with any kind of mental health background or at child advocacy centers, you guys know that sexual development is not something that we just wake up one day when we've hit puberty and all of a sudden that's sexual development. It is something that happens all the way across the lifespan. So I'm a new mom to a beautiful 7-month-old baby, and his sexual development is beginning right now, and it will continue to develop and grow with him as he ages, goes through puberty, gets married one day, and has children. And sexual development really isn't just about sex, right? You may have heard adolescents say, it's just sex, it's not a big deal. But in fact, what we know is sexual development includes all kinds of things, from relationships, communication, how do we hold boundaries with one another, what do friendships look like, and intimacy, closeness. What types of choices do we make around how we use our bodies, and what do we identify as when we connect with others? There's all kinds of physical, emotional changes that happen as we start to talk about sexual development. So where I'd like to start before we get into problematic sexual behaviors is really these more typical sexual behaviors, because all of us are sexual beings. And for us to ignore that fact and think it just happens one day is to ignore a very crucial part of our development. So when we start to think about typical sexual behaviors, these are behaviors that involve parts of our body that are normally considered private or sexual. So things like our genitals, breasts, buttocks, etc. And they're really a normal part of growing up for all children. And these behaviors are things that most professionals wouldn't consider to be harmful. Now, we really want to point out here that this is influenced largely by our cultural and our societal factors, right? So what might be normative here in America could look very different in other parts of the world. And this is true as we start to think about things like modesty, nudity, things like that. What is culturally acceptable here may look very different somewhere else. And so Friedrich and his colleagues developed an instrument called the Child Sexual Behavior Inventory. And that started to look at national samples of which sexual behaviors would we expect at what frequency for kids all across different ages and spectrums of sexual development. But generally, when we talk about typical sexual behaviors, there's a few factors we want to recognize. These are really typically exploratory and spontaneous in nature. They're happening intermittently, maybe once here, once there, but it's not a constant chronic thing. They're typically happening between children that are about the same age, size, and developmental level. So maybe the age would be a little bit different, but developmental ability is the same, and it's their peers, and maybe they're mutually agreeing to engage in these types of behavior, where the key piece is they're not feeling anger or fear or intense anxiety when they engage in these behaviors. And this is a normal part of growing up. So I love to include some pictures here, right? What these boys are doing in this picture, kind of cute as they're little. This is what we would consider really typical sexual behaviors. Nothing that we need to pick up the phone urgently, call our child welfare system and freak out about, right? And young children are really naturally curious about how bodies work. You may have yourself, as you were young, been playing doctor, or you see mom do something, breastfeed a baby, and so you take your little doll baby and you pretend to breastfeed them as well, right? Children see and children do. So when we look at the research on sex play, All of this data is really retrospective in nature. We have adults that grow up and we say, what was it like when you were a kid? Did you ever engage in any of these behaviors? And what we find is sex play is very common. In fact, most people, about 66 to 80% of adults, will retrospectively report that they engaged in some kind of sexual play as a child. And most of this is never known by parents, right? They may be out on the playgrounds, running up and down on the street, and something may happen, right? They don't go and tell adults automatically. Many of these encounters from the retrospective data we have are between children of the same sex. And when it's true sex play or typical sexual behavior, these encounters are really considered as positive or neutral. We have inconsistent results with siblings, so we know a little bit less about that. But what we do know is this is not at all related to adult sexual orientation. So you see kids like this, they're school age in nature, right? We've got maybe 6, 7-year-olds here. They're out playing at the sprinkler, they're down to their underwear and they're running around. How do you respond to this, right? You're the parent, you see them do this. You're probably gonna go, oh guys, stop doing that, right? And hopefully what then happens is they stop doing it. It's not a problem, it's typical, and we just move on from there. So we want to encourage, if a typical sexual behavior is happening, that parents will get calm, stop the behavior if it's in progress. We want parents to educate about accurate names and functions of body parts. I'm really big on helping to encourage child sexual abuse prevention by giving kids the language to report anything that would ever happen. So just like I referred to my elbow, my forehead, my son has a penis, right? Daughter has breasts, and that's a normal part of our bodies. We want to provide them with developmentally appropriate sex education, and this changes across the lifespan as well. It starts by labeling body parts at diaper changes and when clothes are off at bath time, and it continues to change as kids get older and start to develop in puberty. We want to make sure they have information about what our social rules of behavior and privacy and modesty are here. So those kids that were peeking at each other's private parts, perfect opportunity for them to learn. That's not okay here, and here's why. There are private parts, we keep them private. Helps them to learn about friendships and relationships with others and what's okay and not okay, and how they can respect their own bodies. So this is a starting point, and certainly many of the sexual behaviors that you're going to see with kids, even kids you work with, are going to fall in this more typical range. But sexual behavior, we know, goes along a continuum. So we have typical all the way to more cautionary and moving into problematic. So we talked a little bit about typical behaviors. They're exploratory, we agree upon them. Kids are about the same age and it's happening periodically. Where then we move into more problematic behaviors. Maybe kids are planning out what they're going to do. They're coercing other kids. They're different ages, bigger age gaps, and it's really preoccupying a lot of the thinking that they have. So then we move into these problematic sexual behaviors, and this is essentially behaviors that, again, involve our private parts, that are developmentally inappropriate or potentially harmful to themselves or to others. Now, these could be illegal behaviors in nature and could involve some law enforcement involvement, but it certainly doesn't have to. And there's a wide range of motives and origins for these behaviors. I wish we could point to it and say this is the thing that causes a problematic sexual behavior, but as you'll learn here in just a little bit, we cannot do that. And we have this large continuum, and the middle zone is maybe the hardest to point out and say, is this problematic? Is this typical? Does it need professional help? So as professionals, as we start to determine what are some guidelines for knowing if a behavior is typical or problematic, we want to look at a few different things. So the first thing we're going to start with is that frequency. When behaviors are problematic, they're happening usually a lot. and they're excluding some of our normal childhood activities. So sometimes problematic sexual behavior isn't interpersonal in nature. In fact, it can just be, maybe I'm engaging in excessive self-touch behavior, what some may call masturbation, right? And maybe it's that I used to really like to go run up and down the street with my friends, but now all I want to do is hang out in the bathroom or the living room and touch my private parts because I figured out that it feels good, right? So if it starts excluding our normal activities, that's going to lean a little bit more towards problematic. This other piece is unresponsive. So earlier with the picture of looking at one another's private parts, we peek at them, parents step in and they say, oh, no, we don't do that. What we want to see is that kids are responding to that and they go, oh, okay, yeah, I shouldn't have done that, and it stops. Or maybe it happens one more time, another gentle reminder, and it stops. But if we're using our typical parenting strategies and the behaviors are still happening, that's going to lean us and shift us more towards this idea that it's a problematic sexual behavior. We also really want to consider development. So like we mentioned earlier, if it's happening between kids that are significantly different ages or at different developmental ability levels, then we're going to start to consider this as more problematic. If they're longer in duration than we would expect and different behaviors, this means different things. Like I just mentioned with the self-touch example, maybe it's okay, it's developmentally appropriate for a 12 or a 13-year-old to start exploring touching their private parts. But if it's happening a lot longer in time, we're in the bathroom for 60 minutes a night, that starts to lean towards more problematic. And is it interfering with our social development? Again, am I able to make friends, or does no one want to be around me because I stand too close to them or I touch them in ways that make them feel uncomfortable? Again, that leads towards more problematic. And then lastly is this column of harm. So certainly intrusive behaviors that involve any kind of oral genital contact, any kind of penetration, those are certainly going to be considered problematic. Anytime we start to consider things like force, intimidation, or coercion, more problematic. And I want to pause here for a second and draw attention to the fact that force, intimidation, and coercion in kids may look really different than what we're picturing in our head, right? When we think of those types of topics, we may say, oh, somebody's holding a knife to somebody's throat and forcing or intimidating them to do this thing. But in fact, it could be, hey, if you tell mom that I did this thing, I'm not going to let you come hang out with my friends this weekend, or you're not coming to my birthday party, right? And that can be a huge deal to kids. So we start to look at some things like that. And then certainly if it's eliciting fear or anxiety in the child that it's happening to, that's a red flag for being more problematic. So we've got a whole list, and this is not an exhaustive list, of rare sexual behaviors in children. You guys could probably identify many of these. Again, this comes from the Child Sexual Behavior Inventory. So putting your mouth on sexual parts, planning how to touch other children, forcing other kids to do sexual acts, trying to have sexual intercourse. Again, none of these are surprising to you. If you saw this in a kid, you would definitely, as a professional, go, yep, we're going to need to do something about that. Now, if you take nothing else away from this talk today, or maybe you're zoning out because we're in the 1 p.m. slump and you need your coffee like I do, I hope that you will remember this. When we use terminology like offender or perpetrator or predator, there's all of a sudden this image that comes to mind. For me, it's that creepy guy with the mustache, middle-aged dude. You just know you don't want to be around him, right? And what happens is, as we sit in our multidisciplinary circles and we start to staff some of these cases, especially in child advocacy centers, we often use language that we would for adults when we're talking about kids. So we might call it the perp or the mini pedophile, right? And it's very, very important that we don't use terminology like this when we're talking about kids. The main reason why is that we view problematic sexual behaviors in children as a developmental concern. So just like we see behavior problems of other kinds, maybe we have kids that need treatment for oppositional defiant disorder or conduct disorder, they have a developmental issue. And it's not something that has the same course that we would see with our adult populations of individuals that act out in this way. So just because a child has a problematic sexual behavior does not mean that they are going to move on into adulthood and continue to have these behaviors. And as such, it's very important that we use language that is appropriate for the types of behaviors that they're displaying. So you'll hear me refer to these children as children with problematic sexual behavior. We use it based off the age group. So you may say adolescent with problematic sexual behavior, or illegal sexual behavior, or youth with problematic sexual behavior. And what that does, if you're familiar at all with person first language, is it really separates the behavior of kids and adolescents from those criminal acts of adults. And we've actually got good data to say that when we use terminology like juvenile sex offender, that we have harsher responses than when we use terminology that separates the youth from behavior. So it's really important. Our language has a huge impact, and it's important that we refer to these kids as such. So when we look at kids that have problematic sexual behavior, we do not have a distinct profile. My husband is a teacher, and I always say, if you were to line up all the kids in your class and I were to say, hey, which one of these kids has a problematic sexual behavior, you would not be able to pick them out from one another. And he always says, oh, I don't have any kids with problematic sexual behavior in my class. And I laugh because, not that he does personally, but they're everywhere. They're in all kinds of schools. It cuts across our demographics, our socioeconomic status, our races. It's not as if we have one set of these are those kids that have those problems. But we do commonly see some co-occurring concerns. So it is not uncommon when a child comes to see me that they don't also have a diagnosis of a disruptive behavior disorder, a trauma-related disorder, or some other kind of internalizing disorder, very commonly anxiety, depression. We also commonly see that kids with PSB have some kind of relationship issue. They may have parents or caregivers at home that are very stressed out, that are maybe not very happy with them or happy to be a parent to them. They may be having relationship problems with their peers. Again, if you're a kid that's got some of these behaviors and you've acted out this way, maybe at school or otherwise, maybe you haven't learned good boundaries around your body, it's maybe very likely that you've had issues making friends. And when we look at the more preschool population of kids, we find that these kiddos are more likely to be female and they're more likely to present with psychological problems. So when we look at rates of problematic sexual behavior, it's very, very hard to measure this. One of the reasons that it's so difficult, and this is probably true regardless of where you're finding yourself across the country today, is that these cases come to us from a variety of different referral sources. Sometimes they don't come to our attention at all. So for example, maybe this happens in a school and the school decides they're going to handle it internally. I'm just going to deal with it. We'll make sure they're expelled for this period of time, in school suspension, or they're sent home, but we never get them connected to actual treatment. Or maybe we pick up the phone and we call our child welfare service, but child welfare tells us, oh, well, this is kids on kids and they're not in the care, custody, or control of an adult. And so we don't actually substantiate those cases and they fall off our radar that way. Or maybe they're brought in to a CAC and they do their forensic interview, and while they're talking about this other abuse that may have happened, they drop in the fact that this thing also happened with other kids, and we kind of freak out and go, oh, we don't want that on camera. We don't want you to incriminate yourself. And so maybe we don't follow up appropriately, or we say, well, we really just help victims here. We don't help those kind of people. And so they don't get the services they need that way, right? So we don't have great data on there's this many kids, but it's estimated approximately 1/3 of sexual offenses that are against child victims are committed by other youth. And this is why I love doing these types of talks at conferences like this one. If you're anything like me, you may have come into this field thinking, I'm going to help prevent child abuse. I want to do that. I want to help child victims. And as you start to do this work, you will very quickly figure out that if we're ever going to move towards preventing child sexual abuse as a whole, and we've got 1/3 of our cases being committed by other youth, this is not a problem we can ignore. We can do all the adult child abuse prevention work we want all day, and if we ignore youth, we're never going to make headway on this issue. It's very common that PSB occurs with other kids that are known by youth. So this is what we know with other types of abuse. It's less stranger danger and more cousin next door, right? And few sexual offenses with youth actually involve strangers. So let's talk a little bit more about how youth end up developing a problematic sexual behavior and what kinds of factors might increase the likelihood that youth will develop PSB. So this is kind of the way back as we started to study this, the main predominant theory. We know a lot about social learning theory. Albert Bandura actually just passed away, but was one of the big people in our community that studied social learning theory. So historically, we kind of had this assumption that a child is sexually abused, and so they will go on to have a problematic sexual behavior, right? I have a PSB, so therefore I must have been sexually abused. And while we know that kids with a sexual abuse history are at more risk for developing a problematic sexual behavior, only a small number of kids that have been sexually abused actually go on to develop a PSB. So we can't say, oh, this kid has been sexually abused, they're going to have a problematic sexual behavior. We should take all child sexual abuse victims and we should make sure that they don't go on to have PSB. So in our preschool population, we know from the data about 33% go on to develop problematic sexual behavior. And in our school age population, we have closer to about 6%. So it's a small proportion of those who have been sexually abused. What we do know, though, is that if a child does go on to develop a problematic sexual behavior, they are at a higher risk for future victimization themselves. So it's really important we get this population access to appropriate prevention work to make sure that they can then keep themselves safe. There are multiple pathways to problematic sexual behavior, and we want to consider the impact of sexual abuse, certainly, but other forms of maltreatment, violence, and trauma. What is parental capacity in the home for providing appropriate supervision? What types of vulnerabilities and strengths does this particular child have? And not just within their family system, but also within their community to help keep them safe. So what contributes to problematic sexual behaviors in children? We look at a couple of different things within this sphere. So modeling of sexuality. Certainly if a child's been sexually abused, there is this propensity for them to then develop a problematic sexual behavior because it's been modeled to them. And I think the case is when we look at our preschool population, this happens much more often. Preschool children should not have had exposure to sexual material. So when they're going on to demonstrate or display some of these behaviors, parents start to wonder, where on earth did you learn this? And exposure to sexual abuse can be one place. But it's maybe not just their own experience of sexual abuse. It could be modeling or exposure to the sexual behaviors of adults in the home. Many families will share small apartment spaces, 1-bedroom studio apartment. And if adults are engaging in sexual intercourse or other sexual activities, maybe that they're learning it from those means. We also have child vulnerabilities. So if a child has behavior problems, developmental or verbal delays, or issues with impulse control, these can certainly be vulnerabilities that make it more likely for them to develop a problematic sexual behavior. Good example of this is kids that have ADHD. Impulsivity can be very challenging, or managing their impulsivity. And so maybe it's that you're at the swimming pool and a young boy sees a woman's breasts in a swimming suit, and impulsively he reaches out, thinks, I want to see what those feel like, grabs and squeezes them, right? Notices, oh, I kind of liked what that felt like. And because of those issues with impulse control, then goes on to develop problematic sexual behavior. So there are certain things like that that put them at vulnerability. Any kind of modeling of coercion, so physical abuse, domestic violence, peer or community violence exposure, or harsh parenting practices, those factors have also really been shown to contribute to vulnerabilities for the development of PSB. And then any kind of family adversity, right? So if I don't have appropriate supervision in my house and mom or dad has to work 2 jobs to keep us afloat, single parents, all kinds of situations where I don't have good supervision, that's going to potentially increase the likelihood that I develop and sustain a problematic sexual behavior. So we have all kinds of drivers and triggers for problematic sexual behavior. We've talked a lot about these. And really what I'd like to point out to you here is that deviant sexual arousal, or this idea that, oh my goodness, I'm a mini pedophile, is rarely the driver for the development of problematic sexual behavior in children. It's different in adults. Again, we're thinking on a developmental level here, and we truly consider these behavior problems. There's a lot of reasons that kids can develop these: attention seeking, impulsivity, curiosity. Maybe I'm into rule breaking and testing boundaries, or I'm just bored, right? Maybe I use it, I've got anxiety as a way to self-soothe, and I've learned that this feels nice and it helps me calm down. Maybe I'm re-experiencing some trauma I've had. So there's all sorts of ways that we get to problematic sexual behavior. But again, deviant sexual arousal is rarely one of them. It would not be a presentation on sexual behavior problems if I didn't also talk about supportive and protective factors. We so often can get into the doom and gloom of what causes this and forget to talk about all the great things that helps kids develop a healthy form of sexual development. So when we have healthy boundaries modeled and supported in our homes, when we talk to our kids about the importance of covering up our private parts, that helps to prevent these types of behaviors from developing. Protection from harm and trauma, having good parental guidance and supervision in your home. Successful experience using skills to cope with big feelings as we have them. The modeling of healthy relationships and adaptive coping skills. Many of the things that prevent other types of mental health disorders also help to prevent problematic sexual behavior in children. Now, as we've been doing this work, I've been doing it for about 10 years, technology is maybe the biggest thing that has changed. It used to be when kids came in the door for an intake appointment, we would talk a little bit about technology. Maybe they had sent a picture, received a picture from a peer, and that was something that came up. Nowadays, it feels like in my clinical practice, I hesitate to even say almost all of the kids, but it certainly feels anecdotally like almost all of the kids have the problematic sexual behavior they're being referred for, and then all these messy electronic and online sexual behaviors that are also going on. So as kids have gotten increased access to recording, to the internet, we all have one of these smartphones in our pockets, and very commonly kids have access to that technology as well. Even with COVID in this last year, many schools are checking out electronic tablets, laptops for kids to do their schoolwork on. And it's not that technology is bad and kids shouldn't have access to it. And some very well-intentioned adults actually put controls in place to try to prevent some of this stuff from happening. But kids are so smart. I will never forget a kiddo that I saw in clinical practice that had come in, he had some problematic sexual behavior, and pornography was also something that he tried to view frequently. Mom has locked down all of the parental control she could think of, really did a good job of trying to be protectful of that. And next thing you know, kiddo has figured out how on his Xbox, his gaming device, he could get access to the internet, but mom had blocked it down. She was being proactive, and he actually called the Xbox support company, pretended to be an adult to gain back internet access on his Xbox so he could watch pornography. And I just thought, oh my goodness, how can parents win in this world, right? Kids are so smart and so savvy when it comes to technology, and they use it for a range of ways to communicate with one another, to learn, to get access to entertainment. Kids are creating their own identities in the online world, and we're seeing a lot of times now, kids may not, if we're not talking to them about the potential harms of using these devices, that they may engage in behaviors that they don't realize are harmful to themselves or others. So one example of this might be sexting, right? Somebody takes a picture, sends it to a friend, that gets distributed, right? What kids maybe don't realize is that in a lot of states, by sending that picture and receiving it, now I've got access and I'm in possession of child pornography. There's been some work in some states to be able to distinguish this is a youth-produced image versus this is someone creating child pornography. But we have seen certainly more than once with cloud storage and that sort of thing, that kiddo is taking pictures of themselves and it's going to the cloud, and now dad's in possession of child pornography, right? And so there's a lot of harms. We don't give parents a good guidebook that says, here's all the topics you need to make sure you talk to your kids about. And technology is certainly one of those things in this sphere that we've got to be paying more attention to. So problematic sexual behaviors in kids are really a family problem. And kids, like we talked about earlier, often act out with other kids in their social network. This can especially be family members, so a sibling, a cousin, somebody like that. And it really is important that we think about how families are responding to this problem, because we want the message to get across that there is hope for this child. We have effective treatments that work, but this is a serious issue that we need to attend to. And not only for the youth that has problematic sexual behavior, but also for the child who is potentially victimized as well. So I want you to put on, maybe some of you on this call are parents yourself. If you're not, just imagine you're a parent for a second, and you've got maybe a school-age kiddo that you were just told by the neighbor that your child acted out sexually with their kid, and they did it. How are you feeling in that moment? If it were me, I would be really freaked out. And in fact, when we talk to parents, they tell us all kinds of things about their feeling. They feel a lot of shame and guilt over the fact that their child acted this way. They may immediately feel angry, like, oh my goodness, why would you do this? You know better, right? I might hold some of those myths and misconceptions that there's no hope for my kid, that they're basically a mini pedophile and that this is our life now. The kid's the problem. Or maybe my response is, there's no problem at all. My kid wouldn't do that. What are you talking about? It can really cause division in homes. And certainly what we know about sexual abuse and just the rates in our population, if a parent has their own victimization history, this can be very triggering for them to learn about as well. So when we think about the other child that's involved in the problematic sexual behavior, what some may refer to as the child victim, how they're feeling about this is going to vary. Certainly some kids may not have a really negative response to this, and it may depend on how scary it was, how intrusive it was, the type of problematic sexual behavior that happened, how big the age difference was, how often it happened. you guys know, it's not a one size fits all. And just because a trauma or a PSB happens doesn't mean that every child is going to respond in the same way. It's very important that we make sure that this child gets adequate assessment to determine if they're having any other negative consequences in response to the problematic sexual behavior. What we do know is they also may feel a lot of confusion about what happens, like, that didn't feel right to me, or I know that we're not supposed to do that, and I don't get why my brother did. Might lead to some sexual behavior problems in themselves, right? If I'm a younger kid and someone older did this to me, maybe then I act out with a kid that's younger than myself. I have one of those cases right now. We may have some anxiety or depressive symptoms, even PTSD, which again is why it's so important that we get a good comprehensive assessment. And it may be that I'm having all of these symptoms not from the problematic sexual behavior that occurred, but from some of those other factors that are going on, the family disruption and the stress and lack of supervision. But it's important that we have a comprehensive assessment to really figure out what's going on. We also have this impact on the family system, feelings of disbelief, shame, guilt, embarrassment, divided loyalties. Maybe I'm not the biological parent of the kid that had this behavior, but I brought in my own biological child, stepchild, right? And this kiddo acted out with this kiddo, and now you've got parents at odds with each other, or family members, aunts and uncles that really feel understandably an intense desire to protect their child or not believe what happened. And it can be really confusing for families to work through this. There's a lot of myths again, and we'll talk through some of these in just a minute, but no hope for the future. Or the flip side, the problem is the child, and getting help where I have to be involved in therapy as the parent. Why on earth would I do that? It's my kid that has the problem. Or this isn't really that big of a deal. Kids will be kids, I'm not too concerned about it. So very varied response to these types of behaviors. And like I mentioned earlier, kids that have PSB present with a wide range of traumas, not just sexual trauma. They may have disruptive behavior disorders, behavior problems that have to be managed. And when we are addressing these things comorbidly, we have to make some decisions about what our priority is. Do we need to go straight to PSB treatment? Is trauma-based treatment, traditional TFCBT or otherwise, most appropriate? Do we need something like PCIT to address the more behavioral concerns? And we have a lot of different routes we can go, and the real answer is it depends on a lot of things, but these are all things that clinicians have to consider when treating these youth. So when we look at, should this be a PSB treatment? If it's really aggressive, coercive, forceful, not responsive, we've got prominent safety concerns, or happen between siblings, and now we've got to figure out how are we going to keep everyone safe, really impactful to others, we may decide to go straight to PSB treatment directly. If we've got a really significant trauma history, I work a lot with youth that are in foster care and they've bounced around to lots of homes, they've experienced chronic sexual abuse, they're really confused about what is appropriate and okay, and have a lot of shame about their own bodies. Maybe a trauma-based approach is more appropriate. And specifically, if we're having significant re-experiencing symptoms related to our trauma, then going a straight PSB route may not be most appropriate. So we want to think through some things. How much are reminders of my own trauma history the trigger for me breaking sexual behavior rules? What types of protective and safety and support factors need bolstering in the home? What is the family's priority? We are collaborating as mental health professionals with families to decide together what the family's needs are. And so what are they most concerned about? And we really, as professionals in mental health, can integrate components of all of these treatments when we have comorbid conditions going on, so that maybe we start off with safety planning related to the problematic sexual behavior, and then we move into a more trauma-based narrative approach while also incorporating pieces of healthy boundaries and relationships, impulse control skills throughout treatment. So it's not a one size fits all. Let's close out today talking about some myths and misconceptions about this population. So the biggest misconception I see as a professional in this space is this belief that kids that have a problematic sexual behavior have to go to an inpatient facility. They just have to, right? We've got to get them locked up and make sure this doesn't happen again. And the truth is that, in fact, kids often can live with other children at home and do outpatient-based treatment very successfully. There are things that we want to consider before making that decision. Do we feel like caregivers in the home have the capacity to provide supervision and safety to everyone else that's there? So if this is a family that has maybe a single parent in the home, has to work multiple jobs, and they don't have someone to supervise the kiddos, then I don't know if they can live safely together. But if we're able to set up structures in place where they have good eyes on supervision, it's much more likely that they can be maintained at home with other children. We want to think about how are they responding to adult supervision and guidance. And who are these other children in the home? Is it another child that the child with PSB acted out with? And how does that child feel about them staying at home? Do they have a lot of fear around it? Maybe it's time for kiddo to go live with grandma for a period of time so they can have that separation and honor the wishes of the child that was acted out upon. Or do they feel totally fine with it as long as we establish some rules and boundaries around this? Another question we get quite often is, can children with PSB attend school safely? And again, it depends, but most likely yes. We want to think through what are the behaviors that occurred? How did we break down on supervision that this even was able to happen in the first place? Was it a PSB that happened at school, maybe in a bathroom stall between breaks? And how can we communicate with the school to make sure that appropriate supervision plans are put into place so that they don't have that opportunity again? What are the school and teachers' risks and strengths in being able to provide this support? And do they understand truly the need to be protective of all children that are at the school? And I kind of mentioned this just a minute ago, but this thought that children with PSB need intensive residential services or to be incarcerated. When we think about the scale of intensity of treatment that's needed, our inpatient treatment services really should be reserved for the most severe cases. So if they've got really significant psychiatric disorders, highly aggressive sexual behavior that's happening even though we're providing close supervision and outpatient treatment, those are the types of cases that might warrant inpatient treatment stay. But even if we move to this higher level of care, the focus of these services really needs to be on rehabilitation and not on punishment. We do know that it's a small number of cases that actually warrant this intensive level of care, and that there are highly effective outpatient treatment programs that have demonstrated very low recidivism rates, about 2%, which I'll get into in just a second. So looking at levels of care, we have outpatient programs, day programs, intensive ecological models like multisystemic therapy, therapeutic foster care, transitional homes. We go up and up and up and up and up all the way to a locked secure facility. And this triangle is meant to represent the fact that most of our children can be served in this outpatient way. And looking at the cost from a systems perspective and our policies around this, it starts to get much more expensive as we go up the continuum. So we want to be matching children to what they need to have the most successful outcomes. Last but not least, will kids with PSB grow up to become adult sex offenders? We know from the research literature that most children and adolescents, about 98% of them, show significantly lower to no problematic sexual behavior after short-term outpatient treatment. And we do not have any data that would suggest a clear link between having a problematic sexual behavior in childhood or adolescence and then going on to have illegal sexual behavior in adulthood. There was a wonderful study that came out in 2006 done by Carpentier, Zalewski, and Chaffin. And what they did is they looked at kids that had problematic sexual behavior as one group as compared to kids that had ADHD. There was actually a third group of play therapy, but that's less important to our discussion today. And what they were able to demonstrate is that kids that got 12 sessions of cognitive behavioral therapy, or PSB-CBT, had a less than 2% chance that they would ever go on to have another problematic sexual behavior. And that was compared to this comparison group of children with ADHD who had never had a PSB, 97%. So those kids, not clinically significant, did better, but they're really showing at the same rate that if we get kids into good, effective, evidence-based outpatient services, that there's a less than 2% chance that they will ever have these behaviors again. And that, to me, is a message of hope. So when we talk about evidence-based treatment and what that needs to contain, you heard me just reference PSB-CBT is one option for that. The key to good quality treatment for these kids is that they have to directly involve caregivers. This is not a treatment where you just drop off the youth and say, okay, see you in 60 minutes. This is a situation where caregivers need to be active participants in their child's change process. They're learning things about behavior management, rules around sexual behavior that they need to model in their home, how to talk to their kids about sex education, abuse prevention, all of these topics. And we want to help them plan for safety and preventing future PSB in their home, in school, in the community. We want to encourage pro-social peers for these youth and positive peer interactions. And when we talk about this very small group of youth that have deviant sexual arousal that require specialized individualized treatment, we don't actually have good evidence-based treatments at this point to help those youth. But in fact, we know that that proportion is very, very, very small. So you guys are coming from a lot of different backgrounds today, and I always get the question, how can professionals help in this area? I want to acknowledge first that we all have the same goal, which is to keep kids safe. And this can be a very polarizing topic when we bring it up because we all have a heart for children. We want to keep kids safe. And it can feel as if by supporting youth with problematic sexual behavior, we're in some way minimizing the harm that has been done by children who have been victimized. But that could not be further from the truth. In fact, it's the opposite, that we want to get these kids with PSB the help they need so that they learn and they never go on to do this again. We all want to promote community safety, kids to be healthy, and sexual behaviors to stop. And so in order to do that in a multidisciplinary approach, we have to stay away from treatments that are harmful, policies that really are punitive in nature and do not rehabilitate these youth, and messages that are incorrect and based on false assumptions that kids will grow up to be something that we just don't have the data to support. We want to provide accurate messages to families around these behaviors. Again, that this is a serious issue, but there is hope. We can get you help for this. We want to assess the needs of all family members and give them the appropriate resources. So maybe it's trauma-based services for the youth that was acted out upon. Maybe it's treatment for the child with PSB. Maybe it's support services for the family during this very stressful time. We want to recognize that the needs of these families are very dynamic and change and should be assessed regularly. And we want to connect everyone to the appropriate services and resources that they need. We want to take an individualized approach to the safety of all members of this family system and create with them a safety and supervision plan that's going to help promote safety in the home. And we want them to have coordinated care and support through this process. So I'll go ahead and stop there today and draw your attention to a few resources. The National Center on the Sexual Behavior of Youth, or NCSB-CY, can be accessed at their website at www.ncsby.org. We provide national training and technical assistance for therapists, mental health professionals, child advocacy centers, and really multiple multidisciplinary teams at large to learn how to respond to these youth. And this is a great place to go if you've ever got questions about much of the information I talked about today. It's a great place to go. The National Children's Alliance, I'm sure many of you are associated with, they have done a tremendous job to make supporting families in this area a priority of theirs. There are some great fact sheets that I've included in the files that you can access, the where we begin, what we can do, and what happens now, that were developed to help individuals respond to or understand the needs of these youth with problematic sexual behavior. And on their website listed right here, you can find a tremendous amount of resources, basic information about these youth, and trainings in this area. The Association for the Treatment of Sexual Abusers is a great resource as well, and they have a task force report that talks about some of these myths and misconceptions and recommendations for policymakers moving forward on how to respond to these youth. And then certainly the National Child Traumatic Stress Network is a great place to go regarding children that have been affected by abuse and neglect. Lastly, the California Evidence-Based Clearinghouse for Child Welfare has a searchable database of child welfare-related programs and effective treatments for these families. So I will thank you for your time and attention today, and I'll ask Krista if there's any questions that those have had.
Oh, absolutely. We have quite a few. So thank you so much. Very informative information. So our first question, your first question is, how do we support social rules for children with autism or other learning disabilities?
Absolutely. So this is a population that we actually see quite a lot of, and you can understand that rules and boundaries around sexual behavior may need to be more clear and concrete for these youth that have autism spectrum or intellectual disability. And so it may be that in our approach to treatment for a child with problematic sexual behavior that has one of these diagnoses, that individual or family-based services are most appropriate to make sure they're really getting the detailed support that they need to understand concretely what's okay and not okay.
Okay. And our next question is, she would love to know how much of our biases and past experiences history play a part in what is considered healthy or unhealthy behavior.
Yeah, absolutely. I see this quite a bit when I have parents that have a history of victimization themselves, that they may be very attuned to what their children are doing. And so, for instance, I've got a kiddo I've been seeing recently who was spinning around a pole, right? And that's one of those behaviors that, without the context of, gosh, this is a problematic thing, you may just think that's a kid being silly dancing on a pole, right? But mom, because of her past experience and history, was honed in on the fact that this is problematic, and certainly given the child's history of problematic sexual behavior, was more attuned to that. So I think certainly our own background history and lens of how we see the world is going to impact the way we interpret those behaviors. And that's why I always like to defer to that chart that looks at those three categories of, is this harmful? How frequently is it happening? And those sorts of things.
Okay. All right. And our next question is around started separating his kids during bath time, opposite sex, when they started noticing body parts. Wanted to know, was this appropriate?
Yeah, that's a great question. And when we start to think about more typical behaviors or kids that have never had a problematic sexual behavior before, parents often want to know, what should rules in my house be around nudity? Is it okay if I walk around in the nude? Maybe I did it when my kid was 1 or 2 years old. When do I need to start to stop? I think certainly we give kids the autonomy over their bodies to let us know when they're uncomfortable or comfortable with something. If maybe older sibling and younger sibling are bathing together, and older sibling is starting to notice things about the other child's body, about your own body, or they express any desire for privacy or discomfort, that becomes the time when we separate and say, no, we're going to do this private because we have our private body parts, and that's a teaching way or method in that point.
Okay. And I think we have time for one more. Someone noted that they schedule, in their scheduling of forensic interviews, their forms ask for the name of the perpetrator and then ask if they are adult or juvenile. Do you suggest that they change that?
Yes, I would encourage them to change that. And it's not uncommon at all that we see that. Even here in Oklahoma, where we do tons of this work, working on our multidisciplinary teams, things as simple as our intake procedures contain terminology like this. And I think it is important to be able to present some of the evidence around the harmful effects of using that type of language and just start to model it yourself. So yes, I would encourage changing that language on the form.
Okay. And Dr. Shields, we've had many questions asking if you will make your slides, your presentation available to the participant.
I think the answer to that is yes. Let me go ahead, since I work part of a large team, and make sure I get approval from everyone on that. But certainly I can check into doing so.
Okay. And if you are able to do that, then you would just upload it to the
Upload
file.
them to the files. Correct.
Okay.
Correct.
All right. Well, thank you so much, Dr. Shields. Your presentation has truly been informative, and we really appreciate you bringing awareness and understanding to this topic, problematic sexual behavior in children. Thank you. Take care.
Thank you so much. Bye-bye.
Okay. Bye.